a wonderful question. Dental therapist can do, first of all, above the gum cleanings, but can't do below the gum scalings the way a hygienist does. So the dental therapist, can just do above the gums cleanings. Dental therapist mostly does fillings, drilling, filling, and routine or simple extractions, meaning primary teeth or baby teeth, as I call them, some other. Primary teeth and teeth that are already very loose from decay. So it's a very narrow scope.
So we don't have any of these in Ohio, dental therapists?
No, they're not, they do not operate in Ohio.
Would there have to be something created that the state would regulate for this dental therapist position?
We would need a change in scope of practice law in Ohio in order to have a dental therapist position created in Ohio.
Would be an Ohio law?
Yes.
You mentioned there are 50-some regions that are considered having a lack of
57.
dentists. What size are those regions? Are they townships? How are they?
No, some of them are entire counties. Do we have a map in the?
We do. There's actually a map in your
packet.
folder. Some of them are neighborhoods. Some of them are entire counties. For example, Allen County, the entire county, is a dental health professional shortage area, and Cuyahoga County is marked as a HIPSA also, but only certain neighborhoods qualify.
And that statement about Cuyahoga is also true in Franklin County, that it's particular neighborhoods.
They work under is it the general supervision of the dentist? Is that what does
That's
that,
right.
what does that mean?
What that means is that the dentist must approve what they're doing, but that they work remotely. They can work in a different location, but they can, through telemedicine or other technology, they can send the x-rays and they review with the dentist what they saw, and show the dentist the films, and what they think they should be doing, and the dentist says yay or nay. So they're working under supervision of the dentist, but this enables them to work at another site. So for instance, in Franklin County, if you have a dentist working at a community health center at one location on the west side, you could have a dental therapist working at another location at another health center on the west side, and the dental therapist would seek approval before doing any patient care, but the dentist wouldn't have to be in the same building. So it's a division of labor.
Would the therapist have an independent practice, or would he or she
No.
be associated with the dentist?
Yes. The dental therapist works under the supervision of a dentist, must work under the supervision of the dentist. And that's very important because sometimes you'll hear about the dental therapist working independently. There's no such thing as a dental therapist working independently.
But you're not talking an expansion of Medicaid to pay for this, right?
Oh, no, we're not talking about expansion of Medicaid to pay for this. In fact, if you think about Medicaid provision of dental services now, we have reason to believe that once we create the dental therapist position, we'll be able to provide more routine services for less money in Medicaid and save Medicaid also the huge amounts of money that they're spending on emergency room visits. We haven't talked about this yet, but there's a study going on run by Medicaid now about how to prevent avoidable emergency room visits. And in Southwest Ohio, the #1 reason for avoidable emergency room visits is dental care. The #1 reason for avoidable Medicaid emergency room visits in Southwest Ohio is dental visits. In other parts of the state, dental comes up as 2, 3, or 4. People go to emergency rooms when they can no longer stand the pain. Emergency room physicians have no ability to treat dental problems except to, in in some cases prescribe antibiotics. And those dental visits are costly to taxpayers. Furthermore, you know, a cavity is decay. If you don't treat the decay, it turns into an infection. It becomes an abscess. You know, it gets, and then it becomes a systemic infection. Once somebody presents with that abscess or systemic infection, you're talking about a much more costly course of treatment.
So what are you looking at if you have a dental therapist versus a dentist? What are you looking at in the difference of cost? And, you know, part of the reason that people don't go to dentists is they don't have the money to pay for it or the insurance to pay for it. So explain the difference there.
Right, that's a great question. This campaign is being funded and supported by the WG Kellogg Foundation, which is independent from the cereal company, separate foundation. And they are undergoing studies now of the difference in cost. What we do know is that the dental therapist is a 2-year training program out of high school. Dental school, you have college and years of school. So the difference in training is going to result in a much different level of pay between the dental therapist and the dentist. So we know there will be a substantial reduction in cost for the services that a dental therapist is permitted to provide. But we don't have the numbers yet. And as we do, we'll release them.
Have the Dentists Association or whatever that's called, do they support this or?
Unfortunately not. The American Dental Association sued to shut down the program in Alaska. The program in Alaska was created to serve just the native tribes where people would have to take airplanes to see a dentist. And when that program was set up several years ago, the American Dental Association sued to shut it down, and that lawsuit was thrown out. The American Dental Association is on record as opposing the dental therapist solution. However, don't assume that, don't take that to mean that dentists are opposed to the dental therapist solution. We have many dentists across the country and a growing number of dentists in Ohio who very much support the dental therapist program.
What was their reasoning for opposing it?
It's hard to pinpoint the reason. I think there are concerns about competition with dentists, about dental therapists. You know, at times they suggested that the quality of the care is inferior, but I'm not sure that they're still contending that in the face of the numerous evaluations that have been done and show that there's no difference in quality between dental therapists and dentists, as long as the dental therapist works within his scope of practice. I think there's concern about change. I don't want to speak for the Dental Association. I think the Dental Association can speak for itself. The Dental Association is is promoting other solutions to increase access to oral health care, and we thoroughly embrace those other solutions in terms of expanding access to education services, improving coordination of dental care, making sure that people show up for appointments. All of those different solutions to improve access to oral health are important ones, but none of them address the problem of lack of access to affordable treatment for dental decay. So when they're talking about other promising strategies to improve access to oral health, ask whether those will expand access to affordable treatment for oral decay, and we have not seen any other practical solution. And you know, the dental therapist has been operating in New Zealand for around 100 years. When the Kellogg Foundation asked New Zealand, somebody in New Zealand, if they had any recent evaluations of the dental therapist program, they were laughed at. Why would you evaluate something that's 100 years old when you've been doing it for so long? There's no problem here. You know, they did the evaluations 50 years ago. But, you know, in other parts of, you know, there are many other evaluations more recently from other countries that have taken this on.
Would you liken this to a nurse practitioner, a dental therapist?
That's funny. Originally, I did, in the sense that the nurse practitioner provides some of the services that a doctor provides within a narrower scope of practice. The difference is that a nurse practitioner today in Ohio receives many more years of educational training than the dental therapist does. And I think it's very important to us that the dental therapist receive this intensive training in a narrow scope of area that can be accomplished in little over 2 years. Because, for a couple of reasons. One is that the need is so great, we want to be able to get dental therapists up and running sooner rather than later. Another reason is that dentists, it's very difficult to recruit a dentist to work in underserved areas of Ohio. I mean, if you talk to community health centers in different parts of the state, you'll see that dentists just don't want to settle down there and work there for long periods of time. Dental therapists are recruited from the communities in which they've been raised. They go into this profession wanting to serve their community. And the longer you remove them from the community for the training, the less likely they are to go back to the community.
The situation that she was talking about going to Nicaragua and getting dental care, I've been reading in newspapers and stuff that that's becoming more common. Not to Nicaragua necessarily, but to other countries. People go out of the country to get a root canals because they can save money with the airfare. Are you seeing evidence that a lot of Ohioans are doing that?
I'm not aware of that. What we are seeing is a lot of Ohioans going without routine treatment. That's what we're seeing again and again. That's why we're seeing half of Ohio's adults having had one tooth extracted for decay. And that's what we see again and again. We're seeing people presenting in emergency rooms with, you know, out of control infections.
So
But that's interesting. It's probably going on. We just don't know about it.
if I can